Hello from the land of tequila and mariachi. I would like to say thank you to BTL for this invitation. I am glad and honored to share with you our experience with the spinal decompression system in Mexico. I apologize, my English speaking is not perfect, but I am trying to do my best. My name is Tonatiuh Ávila. I am a physiatrist with a fellowship in orthopedic rehabilitation and a master's degree in healthcare quality improvement. I am the chief of the Physical Medicine and Rehabilitation Department at Hospital Civil de Guadalajara, an associate professor of Physical Medicine and Rehabilitation in University of Guadalajara. I have 10 years of private practice experience, totally focused on musculoskeletal rehabilitation. That's me when I take a shower in the morning. I love the place where I work, and I am sure you would love it too if you knew it. Hospital Civil de Guadalajara was established on 1794 by Fray Antonio Alcalde, the friar of the school. Today is one of the most important hospitals in my country. This historical institution attends the poorest patients in the western of Mexico. The health of the people is a supreme law, is the phrase that describes our philosophy. The Physical Medicine and Rehabilitation Department opened in 1958. Last year, we attended almost 40,000 services. We are the most productive department in the whole hospital. Low back pain is the most common diagnosis. I am proud to tell you that we were the first public hospital in Mexico with the spinal decompression system. We think that technology and evidence-based medicine are the best combination to treat patients with efficacy and safety. I have heard that BTL spinal decompression system was a promising option to improve outcomes and reduce cost and time for recovery. But I found limited evidence and no prior studies in Latin America. We met and decided to design a research protocol. Right now, we are conducting the pilot study non-surgical spinal decompression in lumbar disc herniation. We included patients aged from 18 to 55 years old, lumbar disc herniation, sciatica, and/or chronic low back pain, pregnancy, cancer, infection, prior spine surgery, vertebral fracture, vertebral instability, fibromyalgia, and kinesiophobia were exclusion criteria. Intervention consisted in 8 sessions of spinal decompressions with pre-established protocol M7 and added pelvic tilt of 25 degrees. We are evaluating pain with visual analog scale and disability with oswestry index. We are making measures at baseline, post session number 8, and at second month. We analyze the pre and post intervention differences and relationship among variables. I would like to tell you that we have found some obstacles in the way. Initially, we met with the chiefs and attending physicians of neurosurgery and orthopedic departments, but they did not believe in the spinal decompression efficacy. We asked for help to our social communication team, the people that coordinate social media, interviews, and articles in newspapers. They created a multimodal campaign named Treatment of Lumbar Disc Herniation with the Spinal Decompression System. It had an amazing response. We received more than 200 calls in 3 weeks. Everybody wants to receive the modern treatment for their pain. Many patients got disappointed when we cannot include them in the study. I have never seen so much interest in a rehabilitation treatment. 36 patients completed 8 sessions before this symposium. Men and women almost equally, aged 43 years old, most of them with overweight or obesity. 80% of the evaluated patients were employed and 56% had regular physical activity. Mean of pain chronicity was almost 6 years. Visual analog scale score decreased from 7 to 4 after 8 spinal decompression sessions, and oswestry index percentage improved from 30 to 20. We analyzed these differences with t-test and found a statistical significance in both outcome measures. 36% of patients did not have more than 2 points of improvement in visual analog scale score, but just 1 got worse. No adverse effects were recorded. We recently found a positive, very weak, and non-statistically significant correlations between age, body mass index, chronicity, and post-decompression pain with Pearson coefficient. I want to present this case. Esmeralda. She has 48 years old. She is a secretary and she walks 30 minutes 3 times per week. Her body mass index is 34 and she has low back pain and sciatica since 2019. Her pain improved from 8 to 1 and her oswestry score decreased from 22 to 4%. The following MRI images and testimonial are presented with patient authorization.
¿Cuál fue su experiencia con el sistema de descompresión vertebral?
Muy grata, de mucha bendición. Yo llegué aquí con mucho dolor, contracturada en la parte de mi columna, de los hombros, de la espalda, en la parte baja, y yo sentí una gran diferencia en las primeras 3 sesiones. Se fue disminuyendo el dolor y poco a poco durante estas 8 sesiones, gracias a Dios y a ustedes, bueno, pues ya he perdido 2 kilos, ya me puedo mover, ya puedo llevar una vida más funcional, ya estoy haciendo ejercicio y ya el lunes regreso a trabajar. Fue de gran bendición.
Also, I would like to show you another case. Jonathan, he is 31 years old. He is a nurse and he is sedentary. His body mass index is 24 and he has low back pain and sciatica since 2022. His pain improved from 4 to 1 and his oswestry score decreased from 20 to 10%. His MRI images and testimonial are also presented with his authorization.
¿Cuál fue tu experiencia con el sistema de descompresión vertebral?
Fue una buena experiencia por el hecho de que, a pesar de que no se fueron las molestias completamente, pero se redujo mucho el dolor, el sentimiento de inflamación en el área lumbar, y eso genera mucho descanso y obviamente te quita un peso de encima.
Our preliminary conclusions are the following. Spinal decompression was safe and effective to reduce pain and disability. It is important to say that spinal decompression is not for all patients, and not all patients will improve with spinal decompression, but most will have good clinical outcomes. Spinal decompression could reduce healthcare-related costs and reduce time for recovery in patients with lumbar disc pathologies. It is very important to complete the follow-up of our pilot study and conduct further randomized controlled researches to increase its evidence. This is our experience with the spinal decompression system at Hospital Civil de Guadalajara in Mexico. Here you have my email address, my Instagram and my Twitter accounts. Please let me know any question or suggestion you could have. Congratulations to BTL for the symposium. Thank you very much for your attention.